Friends of mine that first summer knew what a wreck I was. I would try to pretend, but people knew. You know what they said to me? Take care, take care. I mean, what else could you say? This one day, I'm at Whole Foods, and the cashier mumbled, "How's it going?" And I started telling him about my life and started getting weepy. And he's scanning my yogurt, and he starts telling me about his life with his partner who's struggling with mental illness, and he starts getting weepy. And what did I say to this guy? Well, take care. Like, what does that even mean? Well, I started attending a NAMI support group for family members of those with a mental illness. And there I heard not just take care, but you have to take care of yourself, meaning that as a family member, you get to put your own needs first so that you don't get swallowed by your loved one's illness, and you can support the person you care about by staying physically and emotionally healthy yourself. But one challenge about self-care is that a lot of family members are so bad at admitting how strung out they are. I mean, you know how Minnesotans are. I'm not exaggerating. This one guy whose wife had chronic depression said, "Well, it's going pretty good, I guess. My wife slipped on the ice, broke both her arms. I got laid off. Let's see what else. Oh yeah, our cat died. Otherwise, things are okay." I looked at the guy like this, dude, but I can be that way too. Anything not to sound self-pitying. I know that I went through trauma the night of the shower stall incident. I also know a lot of people have it worse than I do. But I learned there's no sense in comparing your pain with anyone else's. It's just good to hear a peer say, "Gee, that sounds really hard. You're not alone. You're going through a lot. I hope you're taking care of yourself." Now, not surprisingly, a whole lot of people in support groups are in therapy too. I was, and I want to thank JFCS specifically. I don't think the conference organizers know this, but the first counselor I saw during this ordeal was someone at JFCS. I was in a crisis, not that I could identify it that way at the time. I was so exhausted, so uneducated, fearful, and confused. I was battling my inability to express my feelings. I mean, on top of everything else, I'm a guy, and I'm me. So when I called the agency, the poor intake worker who heard me carrying on got me an appointment that very afternoon with a counselor named Barbara. And she was just the right person. She listened, she watched me, she saw me sob. She said, "Jeff, your wife is sick. It's not you. There's something wrong with your wife, and you have to find somewhere safe to stay." I thought, well, gee, can I sleep on the floor under your nice desk? Obviously, I had a lot to sort through. Over time, I saw 2 therapists off and on during crises, and when I felt like I needed a tune-up, it was so important for me to admit I was hurting and confused and then get the help that I needed. Now, I need to say something about couples counseling. First off, I want to tell any family counselors who are attending the conference, I can't stand listening to myself talk about my own problems, let alone spend 8 hours a day listening to couples bicker. Well, when Leah was manic that first summer, we tried marriage counseling. Leah was usually late or didn't show up or spent the whole time jabbering. The fact is, there wasn't a whole lot a marriage counselor could do or say when Leah was manic. We tried a different person the following summer. You know what they kept telling Leah and me? We needed to work on our communication issues. Which brings me to this point. Sure, Couples can always use help with their communication issues. Listen, I know about issues. I have a million of them myself. I could be a sullen baby. And I know counselors are supposed to remain neutral and ask questions. But for us, marriage counseling was counterproductive. The premise was that I was half the problem. Look, I just wanted a wink, the subtle shrug, some indication that the problem in our marriage wasn't my inability to use I statements when my wife was screaming at me. The problem was my wife was in the middle of a manic episode, and the counselors either couldn't recognize it or they didn't acknowledge it. We finally did find the right person, 2 years into all this, on the third go-around. A psychologist when Leah was depressed. Someone who listened to our story. Someone who said gently, Leah, the problem is you have bipolar disorder. Now, this counselor wasn't taking sides. She was being observant and candid. In fact, when I was being uncommunicative or temperamental, this counselor called me on it. Her honesty opened the door to my being honest with Leah and with myself. I'll have more to offer about self-care later on. For now, I want to say something about talking to friends. I was so afraid of sounding self-absorbed. I mean, my friends all had their problems too. And that figures, even prior to the pandemic, about 1 in 5 Americans experienced mental illness each year. And that number rose to 40% this past January. But I'll tell you, there was something about opening up to people. It helped them open up to me. And before I knew it, people were talking to me about stuff that actually mattered in their lives instead of shoes or the place kicker problems of the Minnesota Vikings. And in the same vein, I also want to talk about neighbors, because this story truly was a turning point for me. Now, our neighborhood is really tight, and I'm sure the neighbors knew something was wrong. When she was depressed, they wouldn't see Leah for weeks at a time. When Leah was manic, they saw and heard some bizarre things going on at our house. Well, here she was in the hospital that first September. And for my own sanity and to fight the stigma, I decided to spill my guts to the neighbors. I started next door with Barb and Hal. I knocked on the door. They invited me in for coffee. So here's the deal, I told them. The thing is, I was like blubbering. Leah's been diagnosed with a mental illness. She's got bipolar disorder. I mean, I could barely even say it out loud. And then my voice started cracking. Well, Barb said to me, you know, our Sam's got that too, which I never knew. Sam is an adult now. They said he was doing better, which I was so encouraged to hear. And that's how it went as I spilled the truth to my neighbors. Everyone seemed to know something, someone with something or other. Everyone felt bad for me, especially bad for Leah. Everyone cared about us both. Everyone asked what they could do to help. It's hard to explain just how listening to my story with grace and without judgment was exactly the help I needed. But here's where this business about community can get sticky. I had a really hard time navigating what to say to our mutual friends and our relatives. For sure, Leah didn't want me telling everyone our business, and I respected that. I wanted to protect her dignity and privacy. But you know what? At some point, I got over it. My wife was hospitalized 4 times. For my own self-care and well-being, I let people know what was going on. If Leah got mad, well, she was mad at me already. And so many people reacted with kindness and compassion, because the more we talk about mental illness and mental health, the more we understand what it is, and the less secrecy, the less stigma. I was also lucky to get support at our synagogue, Shir Tikva. Now again, Leah really didn't want me advertising her illness, but it came to the point where nothing else was helping. So I decided I had to literally stand up and ask our community for their prayers during the Misha Beirach, or prayer of healing. Now, in some shuls, the service leader reads the names of those in need of healing. In ours, we each stand up and say the name aloud. If nothing else, I needed the strength of their prayers, and I am forever grateful to my fellow congregants, and especially Rabbi Deborah Rappaport, for that gift. One other part of the community that entered our lives was law enforcement. Isn't it striking, isn't it astounding that I've been talking about a medical illness and it's 2021, and at least in our country, you have to bring up the police when you're talking about mental illness. In 2015, 42% of the Anoka Metro Regional Treatment Center patient population arrived from a jail. In 2017, sheriffs in Dakota, Ramsey, and Washington counties said as many as 1/3 of the people in their jails had a mental illness, and another third were likely undiagnosed. You all know that at times there are 0 available psych-ER beds, especially in greater Minnesota. The waiting list for children's psychiatric help is a travesty. Well, a friend of mine named Charlie recently retired from the St. Paul Police Department. This guy is one of my personal heroes. The stories I've heard. Charlie had received crisis intervention training, and if you ever wanted a cop to show up during an emergency, he'd be the one. Now, we're Minneapolis people. Leah and I don't agree on this, but I thought the MPD protected us and served us pretty well. But a couple important caveats. First, for sure, there are too few Charlies out there. And not to belabor it, but we are middle-class whites, especially in light of so many stories of police brutality against non-whites and so much injustice for those with disabilities. For me to ignore the reality of the decades of lethal discrimination in our city would be an injustice in itself. I hope that further crisis intervention training and embedding social workers and nurses with responding police teams will improve the situation, but ignoring the problem is no longer an option. Leah and I are privileged to be white people with good health insurance, but a person's fate should not be left to good fortune, social class, and race. And with that, I want to talk very briefly about gratitude. A friend of mine who has struggled with depression, who is a recovering alcoholic, told me she keeps a gratitude journal. Every morning she writes down 3 things she's thankful for. What a great idea for someone who isn't as lazy and undisciplined as I am. Now, I could rattle off my own long list of people and things I'm grateful for, starting with Medicare, our friends, our kids, and my big brother. Add to that the hospital team, nurses, doctors, social workers, caseworkers, and mental health workers who literally saved Leah's life. The pharmacists, advocates, and caring politicians and staff in Hennepin County's psychiatric crisis team called COPE. These individuals get too little attention, or if there's something bad going on in the news, too much attention for the thankless work you all do, and I thank you. But you know what I'm most grateful for? I'm grateful that here I am, turning 67 years old this week, and I have the time to ponder several pressing questions, as well as the deeper meaning of my experience about what I've been through.